So now the second session, we are introducing a very, very interesting person, Dr. Purnima Prabhakaran. She has an illustrious career and is currently the director at the Center for Health and Analytics Research and Trends, Trivedi School of Biosciences at the Ashoka University. She is trained as a physician in Bangalore Medical College. She has a master's in epidemiology from the London School of Hygiene and Tropical Medicine and a PhD in social medicine from the University of Bristol, UK. She was previously additional professor, head environment health, and director of the Center for Environment Health at the Public Health Foundation of India, leading research, training, and advocacy. She was also chair of the research subcommittee in the WHO GCHA CSO working group for climate change and health, and member of the board of directors of the Global Climate and Health Alliance. Now, as director, Center for Health Analytics Research and Trends, Trivedi School of Biosciences, Ashoka University, and Deputy Director and Head, Environmental Health, Center for Chronic Disease Control, New Delhi. Her research portfolio includes studying health effects for environment pollutants on both children and adults. And she's also leading national and international collaborative projects in India on these issues. She's currently also a Lancet Commissioner for Sustainable Healthcare and is a member of technical groups providing inputs to national and subnational programs and policies for climate change and air pollution. As you know, air pollution, the season is just going to start in Delhi, and I think she's going to have a very tough time because I think they're doing a lot of research on that. Dr. Prabhakaran is also the chair of the expert group on air pollution and climate change 2025-26 for the World Heart Federation. So it'd be really good to hear from her. Over to you, Dr. Prabhakaran.
Thank you, Preeti ma'am. Good morning, everyone. At the outset, I must say, it's such a pleasure and a privilege to be here today speaking to this audience. Normally, as technical experts, we get invited to conferences where we are speaking to, we're preaching to the converted kind of thing. But, this is really a very unique opportunity. And that's why they were saying earlier, when I got this invitation, I was really excited. And Mr. Gopi said earlier, I hope this is an explosive experience. With youth in the room and captive energy, it can't be anything short of explosive. So I hope you're enjoying your day so far. Thank you for your interest as well in attending this conference, both here as well as online. Over the next half an hour or so, I'm going to walk you through a very top-line overview of the impact of climate change on human health, as well as on health systems. So some of it, I realized when Dr. Rajivan was talking, might be repetitive, but at the cost of reiterating, I think we will do well to kind of remind ourselves of some of these facts. So I just want to also place on record that I have a dual affiliation. I'm with Ashoka University, but also head the environmental health work portfolio at the Center for Chronic Disease Control. This is not news. This is headline from about a decade ago in the New York Times. 2015 was the hottest year in historical records. The picture here actually is graphics from many parts of the world. So the top one there is a family spending their night on the roof of their house. Then you have a flooded situation in some part in North America. The one below there is a haze in Singapore. And down here is a drought situation in Africa. So the tagline that we like to use is that climate change it knows no boundaries. It affects everyone, everywhere. The rate and the proportion at which impacts occur are probably different. But this is a pandemic that has crept on us from our backyards, and we really need to sit up and take notice. We've heard earlier that there is a changing climate that all of us need to take cognizance of. This is a graphic that shows, this is from the IPCC, the Intergovernmental Panel on Climate Change. And what you see here on the right side of the graph is different scenarios. The one in yellow at the bottom is if everything remains constant. If everything remains constant, we are good. 1.5 degrees or 2 degrees will be in the distance. But what's really happening is, if you look at 2020 to 29, which is the first vertical there, or ahead to 2090 to 2099, some decades ahead, we are just going to be living in a warmer planet. A warming world is what the predictions are showing, and this is something that we are feeling the heat, in a sense, already. And why has this happened? You already saw a graphic from Dr. Nair earlier. If you look at this picture, what you're seeing is the yellow thing on the bottom is actually changes in emissions due to land use change. The pink is due to the use of fossil fuels. So as a country as well, India still depends on the generation of electricity. 70% of our electricity still comes from the burning combustion of fossil fuels, coal, in our thermal power plants. Though we host the International Secretariat for the Solar Alliance, we still are dependent on combustion of coal. So in the last 1,000 years, you will see that a lot of emissions are due to activities that are man-made, and the surges happened in the last 1,000 years. So corresponding to that, you see an increase in carbon dioxide concentrations, and that is translating into this increase in temperature, more so in the last 1,000 years. Just to kind of have us all on the right page, I know that climate change is a buzzword. We were talking earlier, it's fashionable to be talking now about climate change. Every college, every university, every policy think tank government wants to talk about climate change. So I think it'll do us good to kind of understand what is this phenomenon. So I will just spend 30 seconds to 1 minute. So solar radiation actually powers a lot of this climate system. So the radiation from the sun is absorbed by the earth. A good amount of it is reflected back, which is a natural thing to happen. But there is this infrared radiation component of it, which, when it's reflected back, is trapped in the lower layers of the atmosphere by what we know now as the greenhouse gases. And Sir also talked to you about what those greenhouse gases are. And when they get trapped in the lower layers of the atmosphere is when you have this global surface warming, which is called as the greenhouse effect. And these greenhouse gases are the common ones, are the culprits, are carbon dioxide, methane, nitrous oxide, and some gases. The biggest component is carbon dioxide, which comes from a lot of activity. It comes from natural sources, but a lot of it in recent decades has been from what we call anthropogenic or man-made causes. We are responsible for these emissions. And carbon dioxide is the one that stays longest. It's the biggest proportion. If you see that the blue bars over time is the carbon dioxide, which has been steadily increasing. There's also methane, which stays for a shorter period of time, but is very potent. I think many of you, I live in Delhi, and we have these huge legacy landfill sites. We are disposing of all the waste from our cities in these landfill sites. And decomposition and auto-combustion of waste, solid waste, actually, there's spontaneous fires that happen and methane is put out into the atmosphere. That's another potent greenhouse gas. You have nitrous oxide and fluorinated gases as well. So these greenhouse gases are actually staying in the lower layers of the atmosphere and trapping these heat. We talked about nuclei, but they are the ones that are responsible for this global surface warming. And if they are natural causes, probably we can't do much about it, but if they are man-made causes, we certainly need to be cognizant of that and take action. So if we talk about the impacts of climate change, I come from the public health space, but the impacts are far-ranging. The reason being there is rising temperature, there is change in precipitation patterns. You heard from the previous talk a lot about the changing precipitation patterns, rainfalls, floods, thunderstorms. There's also the warming of the water bodies that we have that is causing sea level rise. And the impacts are far-ranging. Definitely on health, because it's changing the patterns of disease. Disease burden is increasing because of the changing climate. But there's also impacts on agriculture, on forests, on our water resources. Coastal lines are kind of depleting, and also on our bioreserves. Impacts are therefore wide range, but I have to talk to you about health, the impacts on health, and this is a favorite one-stop graphic that I like to use. which shows you in a visual medium the impact of climate change on human health. So if you look at it is talking about the impact on human health, but from all of these things that I was just talking to you about: increasing carbon dioxide levels, rising temperatures, therefore more extreme weather events, and also from rising sea levels. You have this outer part of the picture which is showing you all the impacts that can happen on health and health systems. So let me start maybe here. Changes in vector ecology. So rising temperatures mean that there are going to be changes in the patterns of vector-borne diseases. And let's just take mosquitoes. So the changing pattern of vector-borne diseases is because these mosquitoes and the vectors are able to traverse different distances. They're able to kind of replicate faster. They're able to fly higher. So things like malaria, dengue, chikungunya, and all the other viral diseases, which were not seen in some parts of our country. The Northeast, for example, didn't see these trends, but recent years have shown that these vector-borne diseases are happening in those parts of our country, attributing it to climate change. The big one, air pollution. Ma'am was just saying we are on the verge of the next air pollution season. And I think this is not something that has not happened in the past, but in the last decade, 2016, we know, people who live in Delhi, it was called the airpocalypse year. It was the worst year of air pollution, and a big part of the deteriorating air quality is attributed again to things like combustion of fossil fuels, transport, construction activity, urbanization that is just rampant across all of our country, all parts of our country. The deteriorating air quality, if you're breathing poor quality air, intuitively you think it's going to impact our lungs. So respiratory illnesses, more acute respiratory illnesses, coughs, asthmas, but increasingly evidence is showing us, this evidence started coming from the West obviously, but today we have homegrown evidence from our own team, which is showing that rising levels of particulate matter, PM2.5, this is the size of the micron, the particle pollutant, really tiny particles, are having impacts on cardiovascular health. And by that I mean rising levels of heart attacks, strokes, chronic peripheral vascular disease, diabetes. Sir also mentioned that before. Our evidence has shown now, using two cohort populations in the cities of Delhi and Chennai, here working with the Madras Diabetes Research Foundation, we have shown in these two cities that increasing levels of particulate matter, PM2.5, has impacts on blood pressure, on diabetes, on lipid levels, all of which are risk factors for later heart disease. Pregnant women exposed to particulate matter have adverse birth outcomes, early births, stillbirths, pregnancy complications. So there's increasing evidence, and for the longest time, I think in the winter sessions of Parliament, we were asked, where is the evidence from India? You're giving us estimates from the global burden of disease, but today that refrain cannot stand, it doesn't hold water, because we have evidence from India which is showing impacts of poor air quality on a range of health outcomes. And we are continuing to do this research to document it, not just in adults, but also across the life course, in children, in adolescents, and in the elderly. So there is no dearth of evidence. What about water quality? We heard about floods and impacts of what happens to our water, deteriorating water quality. We are already having less water. If there is a contamination of these water bodies, we're definitely going to be seeing a surge in waterborne illnesses. Heat. India is a country that is seeing extreme heat. We are a country that is now seeing the onslaught of heat waves year after year, more in frequency, more in number, but more in intensity as well. And again, exposure to heat waves has shown impacts on human health across the body, not just dehydration, but also stroke, chronic kidney disease, but exacerbation of existing conditions like heart disease and other vascular conditions as well. So there is increasing evidence, and we tend, even as researchers, to work in silos. Let's look at what air pollution does to health. Let's look at what heat does to health. Very few people are thinking about what happens to the interaction of the two. We are not living in a situation where I only get exposed to poor air quality or only exposed to a heat wave. I might be exposed to both, and depending on the geography where I live. So we have now shown evidence that if you're living in a place where there is poor air quality and exposed to extreme temperature, you have a double whammy. But people in the policy-making bodies want the evidence, so we have to really work towards this, and this is what we have been doing for the last few years. I definitely want to point you to this. What happens when we have acute climate events, floods, storms? There's going to be a lot of injuries, fatalities, and in a post-flood situation, people probably lose their homes. They not just lose their homes, their source of food, education, and healthcare access. So there is downstream effects, and what happens to such people who are exposed to these traumatic situations, you have mental health rising as well. So climate change, as it pertains to changing mental health, is something which should not remain in the background. It is something that is coming increasingly into the conversation. And of course, the overarching thing of environmental degradation and people migrating. There is a new terminology now called climate migration and climate refugees. Climate anxiety and eco-anxiety. So these are all terms that are becoming more and more familiar in the climate dialogues, which I think as journalism students you will definitely come across. So I knew that I was coming to the ACJ and that there are students not just from India, but from neighboring countries as well. So I thought it is important to say, take the narrative across from India to the entire Southeast Asia. Why are we talking about climate change so much over here? It's because increasingly we are cognizant of the fact that it is the biggest public health challenge of the 21st century from all of these events that we are seeing. But I think it's not all gloom and doom. We also like to phrase it as in a positive way and say it is also the biggest public health opportunity of the 21st century. And why do we say that? I think once you recognize that it is a problem and start to think about taking actions, solutions, adaptation, we are already on the path to remedial measures. So I think it provides us the biggest public health opportunity. And I want to also reiterate the fact that in this part of the world, in South and Southeast Asia, it's increasingly important for us to work for the climate change crisis. It is a health crisis. And this graphic, again, it's from The Lancet, which is a leading medical journal in 2009. The top half of the graphic, it's a heat map, what we call a heat map, is showing you where the legacy carbon emissions came from. So there are certain parts of the world, we don't have to name them, which grew at their own, whatever pace they wanted, and there's been a lot of carbon emissions, greenhouse gases that have come. There are parts in other parts or geographies of the world which were not responsible for those carbon emissions. But there is no space for complacency because of what you see in the lower half of this graphic, which is where you're seeing the impacts on health and health systems. It's the other parts of the world where we live where you're seeing the biggest impacts on health and health consequences, which is why we need to take some action right away. And this kind of summarizes the impacts on health. This is also from WHO data, that between 2030 and 2050, climate change is expected to cause an additional 250,000 deaths. It could be from malaria, it could be from diarrheas, it could be from heat stress. But direct damage in the terms of costing is anywhere from US 2 to 4 billion USD. And countries where we live in South and Southeast Asia are going to face the biggest brunt, not least because we are still on the path to what we call universal health coverage. We want to cover our entire population in terms of healthcare access. But we also need to stop and think about climate change. And we already have overburdened healthcare facilities who have our old legacy things of communicable diseases, maternal and child health diseases. But now we have this new problem of environmental health, environmental risk factor related diseases that we need to take cognizance of. We cannot be complacent. So it's a huge challenge. We have to walk a very careful path, but we also are recognizing that it's going to have huge social and economic costs. This is a report from, I think, about 3 or 4 years ago, which put the cost at US $86 for every additional ton of carbon dioxide for us in India, ahead of countries like the US at 48 USD and 47 for Saudi Arabia. So the impacts for India, it cannot be understated. And I think we also in the Southeast Asia need to think about what it could be for the neighboring countries as well. So how does it affect health? climate change actually is going to undermine. We've heard of we've heard of biological determinants of health because of our own individual vulnerabilities, but there is this new thing about environmental determinants of health. What is our macro environment? The air, the water, the soil. If all of these are getting impacted, we are going to have a whole range of impacts on health because of water quality and quantity being affected, our food security being affected. There's this pattern of infectious diseases emerging that we are seeing, and also the disasters leading to things like migration and loss of security. So the pathways is what is summarized here in this figure. So climate change, vulnerabilities due to regional weather changes, heat waves, extreme weather, changing precipitation patterns. Pathways are because of contamination maybe of your water bodies, because of transmission dynamics by vectors. There's change in food and food system. Soil health, so I was talking about what can happen if you have dry surface soils. And of course, our social determinants of health. If you're in a more vulnerable situation in terms of demographics and socioeconomic status, the vulnerabilities are much higher. And in terms of health effects, so temperature-related illnesses, extreme weather-related health effects, air pollution, water and food-borne diseases, vector-borne diseases, effects of water and food shortages, as well as population displacement. So again, that's kind of a summary of how it connects to so many health outcomes. And some of the largest disease burdens we are seeing today, to depict the vector-borne diseases. Even in India, I think that we have a whole program in the Ministry of Health for malaria, but we have a national vector-borne disease control program recognizing the fact that this is a growing burden for our country. And WHO estimates that there's increasing mortality, deaths as well from many of these now termed as climate-sensitive illnesses. And again, this knows no geographies or political boundaries. It's not just India, other parts of the world. This is actually data from the funeral service in a country like France, Paris. Summers, there was peaking of deaths. Then the Hurricane Katrina, which is again a country which is well endowed, but it has no mercy, climate change really. So you're seeing impacts from around the world. This is in Latin America, again a country, developing country. Every heat season, there is peaking of the episodes of diarrhea. This is hospital data from a country like Lima in Peru. So I thought it's important for us to take a fact check. It's all good, like we've recognized the problem. Climate change is happening, it's a health crisis, but there are people who are denying it, there are naysayers, but maybe this is one argument that can make people sit up and take notice. This is a reality check from the perspective of our future generations, the children. This is a report from UNICEF, which said by 2050, every child on Earth, which will be home to about 2 billion children, is forecast to face more frequent heat waves regardless of where they live. Because of we may address our emissions, but this is a fact. Every child is going to be exposed to heat. And UNICEF in its report had this tagline saying, this is the coldest year of the rest of our children's lives. That's a very, very strong statement, which just means that it's only going to get warmer and our children are going to be living in those really red-hot situations. And therefore, I think it's important for us to do some action, mitigation maybe, and protect children from these escalating heat waves. And again, some graphics from our part of the world. India, the heat wave, we've just come through a heat wave season, but it's not just Delhi, it's also other parts of the country, sweltering millions because of heat waves from Delhi in the north to Hyderabad in the south. Also, these changing precipitation patterns. So we see that the rainfall patterns are definitely changing, and what it's leading to is the surface temperatures of our large water bodies, our oceans. Apparently, they're rising at 3.4 millimeters per year. Therefore, you have a lot of weather, the floods, thunderstorms. This is a map from the National Disaster Management Agency, Government of India, which is depicting all the flood-prone regions in India. It's huge. I think about 40 million hectares of India's flood-prone, and it's a recurrent phenomenon. It's leading to a lot of loss of livelihoods, loss of economies as well, and it's being attributed to rapid urbanization. increase in population, but also a lot of activities in these coastal plains. So apart from all the meteorological things that you heard about in the previous talk, India is becoming more and more a flood-prone region. And I think from the health perspective, the Ministry of Health has a national program for climate change and human health since 2018-19. And I think they started working on a needs-based situation. So it was air pollution when they started, so they were working a lot on addressing air pollution. Then it was heat. And the angst was, okay, are we not going to talk about floods? Because this is also happening year after year. So thankfully, I was at a workshop 2 days ago at the NDMA, where they got all the state nodal officers for climate change to kind of reinforce the importance of floods and the downstream effects on health. So it's also the scene in the neighboring countries. I think Bangladesh has one of the longest coastlines and is well known to be afflicted by floods year after year, and leads to a lot of damage to both lives as well as livelihoods. What about these small island countries? This also comes in what we call as the WHO CRO region, the Southeast Asia regional countries. We have about 11 countries here, and Maldives is classified as a small island developing state. If you look at the graph there on top, it's the emissions from different countries. We have the global increase in greenhouse gas emissions on top in blue. You have India and China below. The yellow is actually Maldives. So a small country which is living by itself, an enclosed area, is facing the consequences, the coastal erosion, and it's actually probably getting submerged. And this is a country which depends a lot on tourism. We know a lot of people who go to holiday in Maldives, but this is a country where it's year after year, there's lives, habitats, as well as healthcare systems getting impacted because of extreme climate events. And it's not just the human health and health systems, it's also the coral reefs getting acidified, diminishing fish stocks, which has indirect impacts on probably mental health, because of the indirect downstream impacts of loss of livelihoods. So it's important for us to also think about the neighboring countries that are getting impacted. Nepal, I don't know if there's anybody from Nepal in the audience, but again, a country which is very vulnerable to what we call as GLOFs, glacial lake outburst floods. So the rising temperatures causing melting of glaciers in the Himalayas, and this kind of leading to outburst floods has downstream effects not just in Nepal, but down with us here in Bihar. So Bihar is another state in India which is very vulnerable to floods, not just from its internal changing course of the river year after year, which gets in this flooding that happens, but also because of downflow from neighboring terrains. So this is another country that is very vulnerable. And I think I want to turn your attention to a little bit about the other downstream impacts. We talked about flash droughts and droughts in general as an impact of heat waves. If you look at this map on water insecurity, again, you can see all the red zones where we have not just physical water scarcity, but also imminent water scarcity if temperature keeps increasing at the rate it does. And this is actually showing the FAO statistic for India. There is a certain minimum amount of water that you should have per individual, per country, and India is classified as a water-stressed country. As a water-stressed country, an average of 1,600 meter cubed per person per year is what we have. So we are already a water-stressed country. So if we have contamination of these water bodies and waterborne related illnesses, we have another problem brewing as well. So this is one aspect. And of course, the climate change impacts on water, on vector-borne diseases is something. These are headlines that are coming from the northeastern part of India, Assam. I had a project that I was doing in Assam, so I had fished out all the news that's coming out from this city, largely in Guwahati. So it could be changing temperatures, but also the fact that remedial measures like this, stagnant water bodies, breeding sites for mosquitoes. So changing pattern of vector-borne diseases from parts of our country where we did not think it would ever happen, all kind of being linked back to rising temperatures. What about food? It's an important basic need, that basic necessity. We need food, we need air, we need water. Changing temperature is definitely affecting food production, global food production. Again, India is largely an agrarian economy. We depend a lot on agricultural produce, and parts of our country where there is a huge impact on global food production. So there are farming households that are getting impacted. Food production, not just for themselves, but for their markets and their livelihoods is affected. So food security is directly being linked back to changing climate. The other important thing that nutritionists are now talking about is when there is increasing temperature, the crop maturation patterns are changing. So the nutrient content of crops, if you go down to micronutrient level, how much of zinc or how much of iron, nutrient content of crops is also changing. And therefore, apart from global food insecurity linking back to climate change, we're also going to be having this wave of nutrient insecurity. We are not getting the right proportions of nutrients, and that has downstream effects on our health in a big way. So I think climate change and food insecurity is a big portfolio of work. We have the Food and Agricultural Organization, we have the UN organizations that are also taking cognizance of this. I want to refer you back to a term called syndemic. This started during COVID, but a syndemic is co-occurrence of 2 or 3 different pandemics together. And the one that we talk in the climate change world is about 3 pandemics, especially for countries like India, where we have an existing ongoing problem of undernutrition. We still have like 60% anemia if you look at our National Family Health Survey data. So undernutrition continues to be a big problem for us. We're still trying to deal with that. And then you have overnutrition on the other side, simply because if climate change, the second pandemic, is affecting our food production and we don't have enough food to feed our people, there's going to be this transition to access processed foods. And that's fueling the other end of the malnutrition spectrum. So people, our children, adults, all eating processed foods because they don't have natural foods to fall back on, and you're fueling an epidemic of overweight and obesity. So undernutrition on one end of the malnutrition spectrum, overnutrition, and climate change. 3 pandemics actually fueling each other. There was this term coined called a global syndemic. So I just wanted to point you to that term, but it's something that's emerging, and nutritionists in India and agricultural food systems experts are also speaking to this topic now, narrative around changing climate and impacts on food and food systems. This was mentioned earlier about the economy and GDP. Just like India, Bangladesh is another country that is largely dependent on agriculture. 20% of its GDP, 50% of its employment is for agricultural sector. What can severe drought do to a country like this? So it's going to have downstream impacts on health and economy as well. And really, I think the summary would be then, South Asia, are we living a new climate normal? Kind of just accepting the fact that this is it, and this is what we have. We're going to have heat waves, droughts, floods, changing air quality, and around the region, there is an impact on our lives and livelihoods. But I think these kind of facts, whether it's Mumbai or Indonesia or Bangladesh, I think floods happening year after year. I think yesterday was it Indonesia, I think there was or Philippines, I think tsunami alert. So this is increasingly being called a humanitarian crisis, not least because of the physical event itself, but of the downstream impacts that it has on human health and livelihoods. So very, compelling pictures. And I think changing track a little bit on what is it doing to health as well as health systems. I think I haven't touched upon that yet. But waterborne diseases, this is pictures from Kerala. There was outbreaks of cholera, rat fever, and Punjab. Who would think? I mean, we think of air pollution, but floods in Punjab very recently. Mental health and psychosocial impacts, these are all actually news lines from different parts of the country. Mental health, anxiety, panic disorders, post-traumatic stress, depression. This is another one that we never thought about, reproductive and sexual health being affected, linked back to climate change. The reason being, women, and this is actually data from the ground, women in Assam, Punjab, and other parts of the country actually lack of hygiene kits, menstrual hygiene being affected, or labor being affected, pregnancy during a flood situation, what is happening? So the risk of infection and maternal mortality. And what struck me was that headline, driving children into trafficking or child marriage. That's the easiest, is that the easiest solution? But this is happening on the ground, and I don't know how much of this gets documented, but, and of course, injury and drowning and snake bites, especially in a flood situation. There's lots of post-storm water overflow, and snake bites are another one that don't get documented easily. In terms of the health system, what does it do to the health system? Healthcare facilities are supposed to be the last building standing in any event or disaster because you need to be functioning and delivering care. In an event of floods, you could have not just the healthcare facility washed away, we had classic examples in Kerala and other parts of the country, but the supply chain can get disrupted. Healthcare facilities depend on goods, on services, medicines, equipment. The doctors themselves and the nurses need to travel to the healthcare facility. So how many of us have seen pictures, visuals of people being marooned and having to be taken to healthcare? But how do the doctors and nurses themselves reach there? So entire healthcare system can get disrupted in an acute climate event, and therefore it's important for us to start thinking about building resilience even within the healthcare sector from the lens of climate change. Loss of healthcare infrastructure, that's a picture from a big hospital in, I think this was the Ram Manohar Lohia Hospital, but also AIIMS in Delhi, getting flooded. So it's not just in India. I think the first picture here is a hospital in Chennai. This was the government hospital in Tambaram, 2015 floods. Patients having to be taken out and moved to a safer location because the facility was flooded. But it's also Puerto Rico in 2017, and that one is California wildfires. So it's a systemic issue, I think, globally, that we need to think about, one, the growing burden on health, but also how do we make our health systems more resilient to all these impacts? Because climate change, it's really an equalizer. It can impact anywhere in the world. So it's not that action is not being taken. I'm just showing you this one example. This is from the World Bank, because it's loss of economy as well. They started thinking about an action plan for South Asia and had a lot of statistics over here about how different countries in the region were impacted. But there's also best practices. There are some parts of this region that are actually doing good things. I don't know how many of you have heard about the Ahmedabad Heat Action Plan. So it's South Asia's first successful city-level heat action plan. It was conceptualized back in 2010, where in Ahmedabad, in the city of Ahmedabad, in 1 week, in the month of May, there were 800 deaths because of exposure to a severe heat wave. So they started thinking about it, and year after year, they refined the plan, and today that's become a template for heat action plans around the country. But also in other parts of this Southeast Asia region. And it's a very intersectoral, well-coordinated plan where the health sector, the urban development group in the city, the schools, the hospitals, everybody kicks into action from February each year, starting to refine the plan. And today the city has something called even heat stroke wards, because they've increasingly recognized that people are dying due to stroke as a result of exposure to extreme heat. So today they actually set up heat stroke wards every year. So these are from lessons learned, experiential learning, but it has had some tangible outcomes. So I just want to also flag the fact that South Asia, we are among the countries which have big contribution to agriculture, for a big proportion of our GDP, almost 3 or 4 times the global level. And I think increasing temperature affecting agriculture is an issue that's going to impact economies as well. I want to move to this part of the conversation where I'm talking about the vulnerable groups, really. We talk about impacts of climate change on human health as one big bucket, but really, impacts on health can be very disproportionate. And I think among the vulnerable groups, we put in that category children, for sure, pregnant women, women in general, our elderly, people who are differently abled, as well as people living with existing comorbidities. We already saw air pollution, heat can impact and worsen things like hypertension and diabetes. So people already living with existing morbidities, comorbidities. Sometimes we all have in our families people who have both high blood pressure and diabetes. So worsening of those conditions can happen in acute climate events. And I think we need to have responsive mechanisms to deal with these vulnerable groups, because these are the groups that are going to be worst affected. And within the children, this is again UNICEF, which focuses on children globally. It's a UN organization. They have a children's climate risk index based on certain criteria, and what they have shown again is Afghanistan, Pakistan, Bangladesh, and India are worse off in terms of our children's vulnerability to climate risk. So again, it's food for thought on where we allocate our resources in terms of both money as well as manpower in addressing climate change. So these are again a reminder of this very real problem that is affecting all of us, but more so our vulnerable groups. And it has led to problems like migration. I think time to finish, but I just want to say that what roles do we have, as health responders or communicators, advocates, and policymakers? I think it'll go take a whole day to address this, but I just want to say as health responders, public health people, I think we need to become familiar with terms like resilience, adaptation, mitigation, which is about reorganizing ourselves to kind of recognize the problem, but also cope and adapt. And so far as the health sector is concerned, we have now recognized that there is health impacts of climate change, but there is also the problem that we are ourselves contributing to climate change. Now that's a very different problem. And are we prepared to address it? This is a wake-up call to ourselves, the health people. And I think we need two verticals of action, both climate adaptation, prepare ourselves, but also reduce our own footprint. And is this something that many of us don't recognize, but this was a recognition just a few years ago. I'll just take 2-3 minutes. Greenhouse gas emissions, we talked about it coming from different parts of the world. But if you take it from a sectoral lens, it comes from industry, it comes from transport, it comes from energy sector. Does health sector also contribute to greenhouse gas emissions? What do you all think? Yeah, so this was a report in 2019 which actually quantified what is the amount of emissions coming from the health sector. It's something like 5% of the global greenhouse gas emissions. And if, equivalent to emissions from 500 power plants. And the saying goes that if we ranked all the healthcare facilities in the world as one bucket, together with countries, we would stand 5th as a contributor to emissions. And really the footprint comes from the fact that we need buildings, we need energy, we need water, we waste, we generate biomedical waste. So all of that has a footprint. And if we have to start taking action to mitigate our footprint, we have big actions to take. And I think there's a whole conversation that the World Health Organization, which is an overarching body, has started to address both climate resilience as well as mitigation. So climate resilience as well as environmentally friendly healthcare facilities. And this has become a component of our national program as well, to develop green and climate resilient healthcare facilities, which also are low carbon. There is documents from World Bank that started talking about which are the different components from building, water, waste, energy, but also there are big guidelines now from the WHO. The verticals that they talk about is sensitizing our health workforce, thinking about water, sanitation, hygiene, and waste management, energy use, more sustainable forms of energy within healthcare. Maybe we can use solar, but those are conversations that are ongoing, but also look at different infrastructure and technologies. Telemedicine, COVID showed us that, will have a lower footprint. So I think our team actually developed the framework for the national program for the green and climate resilient healthcare facilities for all levels of healthcare. It had all these pillars from where you site your healthcare facilities, sustainable building infrastructure, how we use our energy, water, how we manage our waste, but also being linked to climate information services like the meteorological department and early warning systems. Unless you have the warnings, you will not prepare yourself. So I think I want to close with what we've understood the problem, what has been done, what still needs to be done is recognition of this fact that climate change is a health crisis. and it has downstream effects for human health, but we also need to sit up and take action as leaders for the climate crisis. And this was during the Paris COP, when there was a call for the health sector to mobilize itself as a leader for this work. And there's been lots of action. We have health national adaptation plans, we have national programs, but also we I think found that even this is GlobeScan report from UNDP, which asked people around the world, what is the biggest impact of climate change? And people said health. So it's a conversation that we are taking forward at the global level in the COP conferences, for example, where health has become a big conversation. I think post-COVID, we said we need to build back better. And we submitted to the COP leaders something called the Healthy Climate Prescription, where we said, bring health in the center of all policies, whether it's transport, energy, agriculture, and there's a whole movement to bring health as the center of the climate dialogue. And I'll close with that. I apologize if I've gone beyond. It's a statement from my mentor, Professor Srinath Reddy, who founded the Public Health Foundation of India. And this he said in September 2018 in a climate change and health conference, we know the problem. Never before in human history have we been so forewarned of a doomed destiny, but never before in human history have we been forearmed also to deal with the impacts of that destiny. So I think I'll close with that. Thank you for your attention.
Hello, everyone. That was a really interesting talk. I think Dr. Prabhakaran actually managed to connect all the dots, because these dots are very important. A lot of times we write about what is happening, and if there's a event which is taking place, a disaster event, we don't go back to, we report on it. We'll keep reporting on it in the beginning, but 6 months later, 8 months later, to see what impact, what the government has done about it, or what how it has impacted people on the ground, we don't generally do that. And actually, let me tell you, even our editors don't encourage such stuff these days, because they don't want you to travel, they don't want you to, go back to a place where you've already reported from. But I think that needs to be done. And some of the things that she said, even I've not heard of before. This whole, especially health systems. It's so important that, we connect health systems to our stories, not only the health impact. I think that, and over there we'd be able to make more of a policy. We can talk to our policy makers about it. I think now I won't take more time. Let's start with the questions.
Hello, ma'am. My name is Shreya Ishwaran. You made a statement while explaining the impacts on health. You said that climate change is the biggest public health challenge of 21st century, but it is also the biggest public health opportunity of 21st century. Opportunity for the healthcare system, or opportunity for all the stakeholders associated with it?
Everyone. I think we can connect it back to every sector of action. Like, in India, I think we have one nodal ministry, which is called the Ministry of Environment, Forests and Climate Change. I'll take one example. They have a national clean air program, and they connect with 8 ministries, but not the Ministry of Health. So I think that is one example for me which shows that climate change is an issue. I mean, because of the wide-ranging cascading impact it has across sectors. I think it's a very intersectoral thing, and it is opportunity for everyone, I think, and bringing health in the center of every sector's programs and policies is so important.
And since we live in the age of tech and AI, how do you think that will correlate with climate change?
I think one immediate thought that comes to my mind is data. I think a lot of the research that we do depends on data from the ground. Like, for example, even building models, prediction, you want to predict heat hotspots, for example, or you want to predict vector-borne disease hotspots for a certain country. I had a project which we just wrapped up. We struggled for a good 12 to 18 months to get our hands on the data sets. So I think AI, ML, whatever, health management information systems, electronic health records, I think in a big way could leverage technology and get back to having very streamlined data, rigorous data which can feed into exercises for predicting disease hotspots.
Thank you so much.
Since you talked about some vulnerable groups and how the impact of climate change is disproportionate on different people, uh, should we then talk about the elite and their lifestyle and how the lavish lifestyle that they live can have harmful effect and can further fuel climate, the harmful effects of climate change? People talk about Taylor Swift and this habit of hers to always use her private jet and things like that. And also, there was Mr. Ambani's son's wedding. It was an extravagant wedding, and there was also some event on some cruise ship. So I don't think that is also very good for the environment. So I just wanted to get your perspective on the lavish lifestyle that some of the elites live and how they can be held accountable for their actions.
Very difficult.
So your question was whether we should talk about it. We can certainly talk about it, and people talk about it. But what can you do about it is the question, right? So I guess, it's for them. And I think, I think these are also the same people who talk about climate change. So I think charity begins at home. I think it's for them to, that realization to dawn on them. But meanwhile, let's put our energy and resources where we can make a difference. I think that's all I'll say to that. Definitely, it's not welcome what's happening, and all of us know that.
My question is that you mentioned diversity and how climate change affects different people. Do you think we also need more detailed as well as localized solutions as well as data? Because on 9th June this year, Hindu published a report where they were collecting, using nano devices, they were collecting this heat index of different people. So there was this one female tiffin cook, and her, while the temperature in Chennai was just 36 degrees, her personal heat index reached 69 degrees by 11:30 a.m.
Point taken. It's very important to decentralize all the data that we are collecting. It's the question about how we then use that data and make sense of it, because there's an issue called data confidentiality. But it's definitely very insightful, and I will draw a parallel also to personal exposure to air pollution. So we have done a study with in a household in urban slum in Delhi. The husband was a rickshaw puller, and he had a device, a personal air pollution monitor. He was going around Delhi peak winter, but his wife, who lived in a one-room tenement, the air filter from her monitor was several times darker, was several notches higher. So I think those kind of insights are important when we start thinking about interventions, and it's definitely useful. I think getting down to local level is very important as well.
My question to you is that in public health systems throughout the world, there is an elitist gap and income inequality that exists. It is accessible to people that can afford it, whilst not so accessible to people who can't. The same gap also exists in climate change impacts, in the sense that climate change impacts more marginalized people, whereas the elitists often have a way of escaping. So would you like to comment on that? And I would love to hear your opinion about that and the correlation.
It's something that it's staring us in our face. We know that. If you're talking only about health systems and access to healthcare, yes, I think when you say public health system, in India it's very different from what you call a public health system in North America. Here, the public health system from the medical college hospitals down to a PHC or a sub-center are accessible to the public. It's just that our people don't want to go there. Many times they will have this out-of-pocket, catastrophic levels of expenditure, but go to a private doctor because they don't trust the system. So I think it's a big systemic issue as well. Sometimes it's not about access, but it's about decision-making as well. So, but it's both sides of the coin. I think accessibility is there, it's as an issue.
So my question is, how are the biotechnology companies using data, AI, and advanced technology to predict these health risks caused by climate change? and to speed up development of new treatments? And are there any new developments that are currently being made that we don't have knowledge of?
Biotechnology companies for medicines and stuff I mean, as linking back to climate change is a different thing altogether. But if you're thinking of things like monitoring for personal data for exposure to these risks, you have Apple Watches, and then you have sensors for exposure to air quality. There's a lot of technology that is feeding into this ecosystem, you know, for measurements, for example, for personal exposure. So sensors, and I think that kind of stuff is definitely there, but we can also use technology for personal level health data. I think that's also being used, but we can talk more if you have a very specific question.
So ma'am, my question was like, is it feasible, because it's not catering to the entire the entire population, because not many people can afford this, because this is a common question here right now, the gap in climate change between the elitist and the marginalized. So how do the biotechnology companies then cater to these marginalized section of the society to actually gain access to these developments being made?
Well, I mean, I don't want to take sides here, but the onus cannot be on the biotechnology companies. Like, we talk about air purifiers, for example, in Delhi, but you know, how many people have access to air purifiers? So maybe low-cost air purifiers will become a thing in the coming months and years, but it's something that's more systemic. I think handling the upstream determinants, having good air quality management plans, and then the onus is on a different set of people. I think it takes both sides to act, top down as well as bottom up.
Thank you.
Sorry, now I'll have to go on to the online questions that have come in. One is from Amutha. She says, hello, thank you for this very eye-opening presentation. WHO released a review on the evidence of plant-based diets and their impact on health, sustainability, and the environment in 2021. Are we also looking at diet as a holistic solution?
From one angle, yes, because I mean, we talked about food insecurity. So if there is a solution to it, it takes all the sectors. That's what my bottom line is. I think it takes food and agricultural sector, energy, transport. I think it takes all hands on deck to address a problem of this scale. And I think definitely diet and nutrition sector needs to take cognizance as well, not least from food insecurity, but also nutrient insecurity.
Then there's a second question. There's another one from Jennifer Kishan. She's saying, I'm a freelance climate journalist from Kolkata. Could you please elaborate a little on the One Health approach to climate change and its significance in combating climate change challenges and building climate change resilience?
Okay, I think One Health has become a big buzzword after COVID, especially. I think the jumping of disease agents from humans to animals, animals to humans. I think that was, the birth of the One Health concept as well. It's something that needs to happen because of the close coexistence, I think, of human beings, livestock, and the chances of jumping of species, disease-causing species. One Health we do have a national program now for One Health, which is kind of bringing all the sectors, agriculture, livestock, animal husbandry, with the health sector to kind of take that lens to this whole problem. And I think we are on the right path, I would say.
Okay, yeah. So that's all in this section. And we look forward to the next section. It's going to be really interesting because it's on misinformation and disinformation. And I think that's something that journalists really, really need. Thank you.